Like many communities throughout the state, the North Quabbin region has its share of challenges, and the North Quabbin Community Coalition's mission is to improve the quality of life for people living in the area. They focus on economic development, programs for youth, veterans, and the elderly. They've also been active in helping residents deal with the opioid epidemic. Carolee McGrath sat down with Heather Bialecki-Canning to learn more.
So Heather, thank you so much for joining us this morning.
Well, thank you for having me.
If you can tell us, first off, a little bit about the services that you offer at the North Quabbin Community Coalition.
So I like to think, and I brag a little bit about this, that we have the coolest mission statement at any place I've ever worked. Our mission is to improve the quality of life for all residents and people who work in the North Quabbin region. So what we do is identify the needs for the region, identify gap areas, and we're a big proponent for what's going right, to bring spotlights on what the good stuff going on is.
Okay, so tell us about some of those gaps in this area.
North Quabbin has often struggled with an economic crisis. So we, through a steering committee of very influential people, we have looked at the need for a community development kind of model. We're looking specifically on workforce training, affordable, sustainable housing, especially for young families. As an example, the town of Athol has 160 vacant and abandoned homes. With not much work and some tweaking of people's credits and understanding of financial literacy, we can put home buyers into these homes and have them back on the tax rolls for the town.
Okay, and also you mentioned job training as well. What kinds of jobs would people be able to get in this area?
So this is an interesting topic because this has really shifted over the last several years. We were formerly mostly a mill town with real factory kind of workforce needed, and we still have the need for some of that, especially with Starrett Tools being one of our largest employers. Right. But we have this booming need for healthcare workforce. So local colleges like Mount Wachusett Community College has worked with Haywood Healthcare recently to put into place a drug and alcohol counseling certificate program and other kinds of healthcare related fields. And we're always trying to attract doctors and primary care physicians to this area too. So those are the kinds of things we're looking at now.
So you had mentioned drug counselors. Let's talk a little bit about the opioid crisis, which I know is an epidemic across the state,
yes,
but certainly a big problem in this area.
Mm-hmm. The coalition has been lucky enough to be a real partner with the Opioid Task Force, which is out of Franklin County and serves also North Quabbin. We have a task force that meets monthly, the Substance Abuse Task Force, which currently has 41 members, just to talk about all of the levels on the continuum of substance abuse, from prevention to intervention to treatment and long-term recovery. So we have several initiatives working on those things. Most recently, we had 32 people march in the River Rat Parade, which is a big deal around here, to talk about just that recovery is possible, that we know addiction to be a chronic disease, and to just inform people. And it was kind of controversial to have that as part of the River Rat, which technically has this reputation for being a party weekend. So for us to bring the thoughts that you don't have to party, there's a canoe race happening too.
Right.
There's lots of options for what sober living looks like.
But you were talking a little bit before we started about long-term treatment.
Yes.
And treatment facilities in this area, which there are none currently, right? But that's about to change?
We're hopeful that that's changing in the very near future. Our task force has had a lot to do with promoting the work happening with the Haywood Hospital. They recently purchased the Sisters of Assumption site here in Petersham to turn that into a place called the Khwabon Retreat, which would be a full-scale facility to look at eventually detox, inpatient, residential, youth, and outpatient services to continue long-term recovery.
Why do you think it is such a big crisis, especially in the smaller towns? Because people might be able to say, okay, bigger cities, we understand that there's a crisis, but when it reaches out to smaller communities like this area, why is that?
I think some of it is, this is not just a poverty problem anymore, but one of the things that we know is that poverty is a factor for why people are looking to self-medicate in a lot of ways. We are learning so much more every day about overprescribing and misuse of prescribed medication, but we're also learning a lot about trauma and about the real root causes for why people end up addicted or, choosing non-healthy lifestyles.
I want to talk a little bit about another program that you have, and that's for children's health and wellness. Are you seeing a big problem with that?
Yeah, absolutely. Part of our issue that we've struggled with for a long time is food access. So we definitely work with that quite a bit, is to increase food access, but also if you have access to healthy food, how do you cook it, you know? And so we're trying to really normalize that so that healthy eating is a normal part of kids' development, and then it trickles down to the parents at home.
Thank you, Heather, so much for joining us
Yes.
and just giving us a slice of life up here in this region. Thank you.
Yes, thank you very much.